Professor Meek. This is Chama Wallace here, and this will be my video for dehydration. I chose dehydration because I think it is very something I can easily explain to a patient that has no knowledge of anything about fluid imbalances. So I'm going to start with the first point. I'm going to make the video very fast and quick. I know you have a lot of grading to do. And for the first point, we have the pathophysiology, and under the description, we are supposed to explain what this is, dehydration in this case, and then what it means, a medical diagnosis for it. So on this note, first I'm going to talk to my patient. Hello, Mr. Wallace. Perform my hand hygiene, explain why I'm here, and then before we start, I'm going to explain what dehydration means. And first of all, I'm going to start with fluid imbalances. This means your bodily fluid, including water and electrolytes, are not balanced. So this can either be a deficit, that is decreased fluid, or overload, increase or excess fluid. Now for this, we have dehydration, which is loss of water and electrolytes, which is in our bodily fluids, which can be our sweat, our blood, and all that. So dehydration, most of the imbalances is due to fluid volume deficit, which this fluid volume deficit, another name for dehydration, is under dehydration. It can be isotonic dehydration, which is hypovolemia, and this usually makes up the 90% of our fluid loss. Like if you lose, like you're dehydrated now, it is mostly because of hypovolemia, which is isotonic dehydration. And the other dehydration types can only covers like 10%, and this is either hypotonic or hypertonic. So for medical diagnosis, in infants, the way you know that they are dehydrated usually is when children have like dry mouth or dry lips, and their tongue is usually like it's not glistening, and when they cry, you usually don't see any tears coming out of their eyes. That's how you know this kid or this baby is dehydrated. Now for adults like you, usually like you're feeling dizzy, and your urine output when you go to urinate, usually it's very dark brown. And also when you're under the sun or you're doing like a strenuous activity, you don't sweat like you normally do. That's another indication of, hey, I'm dehydrated. Now going to the next point, which is our assessment. The description here says we can focus on what our patient is to expect. Now, Mr. Wallace, this is what we are going to do today. This is what you should expect us medical staff to do. This includes, I'm going to ask you questions about your history, whether you have any underlying conditions. I will make sure I go as far back as possible as you can remember. The more you tell me, the better it is for us to treat you. Also, we're going to find out, this will also help us to know if it's the condition that is also causing this dehydration, because it doesn't always mean that because you're not drinking enough water or enough fluid and that's what is causing your dehydration. It might be other underlying conditions that you have that may be causing it. You may be drinking water but you're still dehydrated. So I'm also going to ask you if the dehydration, say if it's caused by diarrhea, I'll ask you how often do you go to the toilet or do you void, and then if you have any other, apart from your medical history, do you have any other medicines or even non-medicines like vitamins and supplements that you're taking. This will also help us in treating you. Now, reducing the risk, reduction of risk potential. Now I'm going to ask you the kind of job you do. Do you work outside? Do you work construction? What kind of, I want to know the kind of work you do, which will also help us to better make a good diagnosis that is going to actually treat your ailment. And also we want to know where you're living. Do you have access to water? Not just water, is it clean water? And how often do you drink? Do you like drinking water? Do you drink your water with flavoring? Do you take a lot of energy drinks? All these are things I would ask my patient, Mr. Wallace. Also, on that note, we also want to know the kind of physical activity you do. Are you a runner? Do you sit at home a lot? Do you do indoor activities or outdoor activities? If you just arrived in the emergency room right now, and you have your hiking boots and all, I want to know where you're hiking. Was that what happened? When last did you have any fluid intake? All this I would ask my patient, Mr. Wallace. Now, for the lab and diagnostics, number 3, here I'm so here we are going to look at the patient's lab to make sure that we collaborate our initial diagnosis. Now, I would want to explain your lab results. When I have it, I will explain to Mr. Wallace. Maybe looking at something like 3 points, mentioning say 3 items from your lab, automatically I can easily say, hey, Mr. Wallace, now looking at your lab, I can see that the serum potassium level is less than 3.5, and or it's higher than 5.0. This is a definite suggestion that you are dehydrated. I can also look at the calcium level. Say if your calcium level is less than 9 or it is higher than 11, that is also an indication of dehydration. Magnesium too is a good indicator of dehydration, which less than 1.5 and greater than 2.5 is not good. Okay, as well as your urine. Now we've taken you voided and we took your urine, we had to measure the density, this also tells us that you are dehydrated, not just the color. Now moving on to the 4th point, which would be potential or actual complications. We also find a way to reduce risk of potential complications during your treatment. Now, this means that while we're treating you, Mr. Wallace, you can easily, it's not common, but it is possible to actually over-treat you, in saying it in a layman term, meaning that the treatment we give you might end up harming you. It is not something that is not impossible. It actually does happen. This can be where patients end up being overhydrated. We give you too much oral fluid or intravenous fluid and you end up being overhydrated, and people have been known to die from that. At this point, your intake is way higher than your outtake, meaning we're giving you more fluids than you are able to actually disperse, that is, urinate. Also, withholding, when it comes to withholding sodium, it is possible for us to end up causing low sodium level, which can lead to seizures and even death. Now, giving diuretics to people that need to be, to end up voiding or laxative. This can end up causing diarrhea, which means the drug had an adverse effect and makes you go to void, not just pee, but you defecate and frequently, and this can make you lose more water fluid instead of helping you retain it. Also, giving too much IV fluid containing magnesium or potassium or even calcium can end up affecting the kidney as well adversely. There is something as giving too much drugs to someone. Now, moving to the 5th point, here we are looking at a nursing intervention. I'm trying to find out, Mr. Wallace, what I can actually do to also help your stay and help you get better quickly and faster. Now, my interventions for Mr. Wallace will include, I'll make sure that I'm charting his vital signs from the initial admission to the ward. This will let me or allow me to see the progression of whether he's improving or he's still normal or he's actually worsening. Now, if I start charting in the mid of his admission, I will not know what his initial vital signs are. So I don't have anything to compare or contrast it with. Also, I will, for my dehydration patient, I will try and make sure I provide fluids constantly and frequently, and also make sure that it is within reach. It's not something that he will need help getting. It will be maybe beside his bedside, and I also tell him if he needs more or he needs any other thing, he can always use the call light. I will make sure I monitor his improvement, not just his vital signs, but his overall well-being throughout his stay. I will also check if Mr. Wallace likes drinking water, and if he doesn't, I will try and find a way to make him like water, at least for his stay, during his stay. Like adding some flavor like lime or lemon or orange to his drink that will help him drink it. Now, if I need to put the fluid in a sippy cup that will help him drink it faster, that I can also do. And also make it his preferred temperature. You do not want to be giving your patient like a freezing cup of water or too hot cup of water. Now, I'm going to also help them with their dietary needs. I'll go over the kind of food they eat, how to reduce like sodium intake or potassium intake, or how to increase it. I'll go over the dietary needs and bring them up to speed on how they can help improve their well-being. I'm also going to make sure I help prevent fall issues during his stay, because dehydration, of course, you'll be dizzy and sometimes tired. So helping prevent falls is another way to help prevent further complications during his stay. And of course, make sure I keep track of his urine output. Now, medications and side effects. Here we want to know some of the medications that will be recommended for fluid imbalances like dehydration. So I have a couple that is possible the doctor is going to recommend for you. This includes antiemetic, which will be recommended for you in your case, Mr. Wallace, since you're dehydrated. But I should warn you, the side effects include drowsiness, you might have dry mouth, and sometimes even heartburns. Now, vasopressin can be used if the ADH, that is antidiuretic hormone, is deficient. I should warn you, Mr. Wallace, this drug can be known to slow the heartbeat, and it can cause dizziness, swelling, or even rashes. So, also insulin or glucose can be used to treat hyperkalemia. This can also have some side effects like rashes, scars, like where you actually inject yourself, redness, and also you can even gain weight while you're taking this treatment. calcitonin prescription can be used to treat acute hypercalcemia, and this medication can cause headaches, dizziness, nosebleeds, and even nausea. Finally, we are going to talk about the patient teaching. This is the things I'm going to make sure that is in order so that your stay here will be good and your treatment too will be top notch. So I'm going to make sure that Mr. Wallace understands all the necessary things that is happening, the medications, the teaching, how he can manage his diet, how he can improve his health. I'm also going to inquire about his habits. Is there anything that is preventing him from getting better? How his family situation is? Does he have a socio-psychological help back home that will help during his treatment? Because if he does not have that, it means that if we can't even release him to go home early if he doesn't have anybody to help him during his treatment. Also, I'll make sure he understands anything, and if he has any questions, this is the time I will let him ask me all the questions he needs. I'm going to make sure I address him properly and that he's finding his stay very well and he's being treated professionally. Okay, this concludes my video assessment. Thank you again, Professor Meg, and also for extending my nutrition mastery class. I am going to catch up as soon as possible. It's just been a crazy week. Thank you so much.